2021 Virtual Community Health Worker Summit. Your presenter for this session is Alisa Howard, CEO and founder of Minority Health Consultants. Before she begins, I'd like to go over some housekeeping items with you. This is a pre-recorded session, but the Q&A section of the Thinkific platform is being monitored to respond to any questions that you may have. You can access the discussion tab at the top right of your course player whenever you have a question to ask. The course player is where you are watching this video now. Just click on the image of the two alternating boxes, then click Create New Post to submit your question. Questions will only be answered on the day the presentation premieres. Today's slides and any additional resources pertaining to this presentation have been made available to you inside the Thinkific platform. You can find them by scrolling down past this video. As a reminder, we do ask that everyone complete a survey about this session. The survey is located inside of the Thinkific platform in the next module. You should be prompted to click Complete and Continue, which will bring up the survey. If you do not receive a prompt, you can still find the survey in the next lesson module. Additionally, it's important that you complete the survey at the end of the week. These are very important, and Do Member Health uses every bit of feedback to help inform future educational events. Just a reminder, this presentation has been approved for continuing education hours for CHWs, CHW instructors, and certified health education specialists. In order to obtain your certificate, you must complete the summit evaluation by April 23rd, so don't miss your window. And if you're on social media, we invite you to engage, to post, to share, to tag us. We're using those hashtags that you see on the screen there. And now to the presentation. Hi, and welcome to the presentation today. We're going to talk about how you can craft a resume and a cover letter. Now, these principles don't necessarily apply to just community health workers. They're really applicable to anyone. But let's go ahead and get started so that you can hopefully land that dream job that you have been looking for. So on the agenda, we're going to talk about some resume do's and don'ts. We'll talk about the difference between a resume and a curriculum vitae or a CV. We'll talk about some cover letter do's and don'ts as well, and also provide you with some tips and tricks to really help your resume stand out above the rest. So first things first, some do's and don'ts. Do use keywords for your resume. So depending on the position that you're interviewing for or the job that you're applying for, make sure that you use some of the same keywords that you see in that job description. You also put those in your resume. So you can see from this example, this person is actually a dental assistant, and they've got some keywords in here that are probably also on the job description as well. Things like infection control, assisting in orthodontic procedures. So it's always smart, and it also will help you get past an applicant tracking system if you can use those same keywords in the job description on your resume. It's also important for you to use standard section headings as well. So these are headings that you see in a traditional resume, right? Your education, your contact information, a skills section, and then your work experience. But you should also consider additional resume sections that really help your resume to stand out, especially if they show additional certifications or licenses or leadership or awards, etc. So some of those things that I've seen on resumes and that I personally have on my own CV is a section for volunteerism or community involvement or community leadership, which is how I have it on my resume. Community health workers do a lot of outreach, volunteering, etc. So you want to make sure that you put that on your resume. You also could consider adding a presentations and qualifications section as well. So if you were nominated for Community Health Worker of the Year, or maybe you had Employee of the Year, you certainly don't want to put Employee of the Month. But if it's a big qualification or a big nomination, you certainly want to put that on your resume because it's a big achievement that you should show to help you stand out. If you are affiliated with any kind of professional or civic memberships, for instance, I'm a member of the Association or American Public Health Association. I'm a member of the Association of Diabetes Care and Education Specialists. So anything like that, the National Association of Community Health Workers, you want to put those professional and civic affiliations on your resume. Any professional development or continuing education definitely needs to go on your resume or your CV. For instance, I'm taking a diversity, inclusion, and equity in the workplace course right now. It's a 7-week certification course. Once I'm done with that and I've got my certificate, I'm going to add that to my CV under the professional development section. You can also include personal and professional accomplishments, which we've talked about. If you have a personal business and you know your job is not a conflict and it's not something you know that you're trying to hide, you can certainly put your personal business or your side hustle there as well. And if you have any languages or technical skills, you definitely need to put those things on your resume so that it stands out. Are you bilingual? Put it on your resume. Do you know how to use virtual platforms? You know, if so, what platforms? Are you proficient with Zoom? Are you proficient with Microsoft Teams? Things like that will really help to your resume to stand out. Make sure you do keep it simple though. I've seen a lot of resumes that have been really colorful and really fun and had a lot of and had pictures and images and things like that. You really want to keep it simple because these days chances are your resume is going through an applicant tracking system, ATS system, and not going to be looked at by someone the first go around. So you don't want a reason for your resume to get kicked out from the system. So keep it simple. Use a nice, clean, structure format. Don't put your picture on it. And then start each bullet with an action-oriented word. You'll see here on Tony's resume, who is also a dental assistant, he's got the bullet format, and each line starts with a different action-oriented verb: assisting in all procedures, presenting and translating, working daily. And also notice that when you're working or you're noting your current position, you're going to be using present tense. But when you're talking about positions that you've worked at previously, you're going to use past tense. So he or she is still using action-oriented verbs here for this job at Aspen Dental, but the verb is past tense. So seated the patient in the treatment area, passed requested instruments to the dentist, etc. Also, quantify your bullets whenever possible. Employers want to know that you can save money, reach the masses. So, you know, you really need to try to quantify as much as you can. So maybe you work community outreach events. Maybe that's your job. You're a community liaison. How many outreach events are you working per year? How many do you average per month? How many people are you enrolling into the SNAP program or whatever the program is that you may be working on? Those are the type of things that you want to put on your resume. So the second line here says, other ways to quantify your lines are examples like reduce cost by 15%, reduce the process time by 20 hours per week, increase revenue by $5,000. If you can find a way to quantify every single bullet, then do so. If you can't do every bullet, great. Quantify where you can. And then do the following. Check your spelling, check your grammar. Use full words and titles instead of acronyms. So, you know, I've checked a lot of CHW resumes, and we have a tendency to use CHW, but everybody doesn't know that CHW stands for Community Health Worker. So make sure that you're using full words and titles instead of acronyms. Now everybody goes to the LinkedIn profile. When you're looking for a job, your LinkedIn profile is going to be viewed. Go ahead and add that LinkedIn profile at the top of your resume, right there where your email is, your name, your phone number, and the other information. Put that LinkedIn profile there. I highly recommend that you consider creating multiple tailored resumes, or either have at least a resume and a CV. And so the difference is A resume, you really want to stick to 2 pages max. A CV is a little bit longer. You'll see these more in educational settings or in academia. So I have a CV, I think it's 6 or 7 pages, but it really includes all of my presentations, all of my publications, so much more. All of those section headings a few slides ago that we just talked about are included in that CV. My resumes, however, are tailored for specific positions. So I have a teaching resume. I have a resume if I'm looking for an administrative position. I have a resume if I'm looking for a program manager or project management position. So really consider creating multiple tailored resumes. And then consider grouping your experience and key projects or initiatives together under one position. And remove dates. If you're a person of a certain age, even though ageism should not exist, we know, just like colorism and sexism, all the racism, all the other isms, that it does exist. So if you graduated, 1945, then you want to make sure you remove that date so that whoever is interviewing you or reviewing your resume for that particular job does not have the opportunity to use your age against you and not call you in for an interview. And always, always, always send a cover letter. Use the same header that you use as your resume or your CV. You want to make sure you use the same font as your resume or CV. It's going to be at least a 10 to 12 font. You want to use a letter structure, right? So this is the date at the top, the individual's name and their address. This letter is regarding, and you're going to start that greeting, dear sir or madam. Or if you have the name of the hiring manager, you're going to say, dear Mrs. Jones, it is with great pleasure that I submit my application or I submit my resume for this position. As with letter structure, your letter should have an introduction, it should have a body and a conclusion. You want to make sure that this is not a really dense letter. Cover letter should not be heavily dense, so you want to avoid huge paragraphs. Your paragraphs need to be, no more than 3 to 5 sentences long. Use bullets to call out those really important points that you want to make. Especially if you have some areas where you can quantify and say, you've reached this many people or you've saved this much or you've increased this percentage, and that's where you want to use those bullets to call out attention to those areas. Use bold font strategically and only to break up monotony. And again, just like your resume, your cover letter should only be 1 to 2 pages max. So don't do any of this. Make sure you do not add your address to your resume or CV. I know that people used to do this. This is no longer the norm. You really want to protect yourself against 2 things. One, you want to protect yourself against identity theft, right? And these days, thieves only need to know like your name and your address, and they can get so much information from you. So you want to protect yourself from identity theft. Secondly, and this is just something that I didn't read anywhere, it just really popped out of my head, but you don't want people to Google your address, see the part of town you live in or the type of housing that you live in, and automatically make assumptions about you or judgments about you based on where you live. So don't add your address to your resume or your CV. Don't make them match your cover letter and your resume. They should not be identical. Add a photo. Don't add a photo, to your resume, and I've already told you why you want to keep it simple. Don't add references unless asked. Remember, you only got about 2 pages of real estate for completing your resume. So don't waste those 2 pages with references that you may not even get called to provide or called for an interview. Wait until they ask you to provide those references. Don't add personal information, so things like religion, marital status, ethnicity, etc. You don't want to add that information there. And your GPA. Yes, I'm happy and proud that you graduated from college or high school or grad school or whatever it is, but unless your GPA was higher than 3.0, I don't want you to put that on your resume. So let's look at this resume example really quickly so that you can see what a before and after looks like when you start to revise your resume based on some of these recommendations that I shared with you today. So this resume, and I know it may be a little bit harder to see, but hopefully it'll be better on the handouts. This is a before and after resume of a gentleman that worked on his resume to make it more visually appealing. And I want you to take a second to look at both of these side by side and kind of make notes about what you see and what really stands out to you. So kind of starting from the top, I'll tell you what stands out for me. First and foremost is the format, the structure. So in his before, he's got the headings here that we talked about: education, experience, and other, but all of the jobs and the dates are kind of off to the side here. That's kind of, it's harder to read because it seems like the spacing is so far apart, it actually stretches your eyes. The formatting is definitely different here at the top as well. He's got his name, he's got his address, he's got his phone number, but there's no email here. So if the employer is interested in contacting him, they would only be able to contact him by mail, which they're not going to do, or by phone, and most employers want to initially contact someone by email first. The other thing that stands out here as opposed to the afters, he doesn't have a profile statement or a summary of qualifications. This is the area where people used to put the objectives. That's an outdated method. We no longer use objectives in resumes. So I really like that he came over here and he actually has a profile statement that is really short and sweet, but it tells you exactly kind of who he is and what he's looking for. So he says, system-minded health policy analyst leveraging interdisciplinary multi-sector approaches to ameliorate health inequities and their root causes to secure health justice for the underserved. Wow, it's a mouthful, right? But it also makes him sound very sure of himself and highly intelligent. So I love that he has a profile statement there. I personally have a summary of qualifications. It doesn't matter, but you do want something there at the top of the resume that's going to stand out. I also want to show the comparison in the contact information section. So you'll see here, he still has his address, which I just said was a no-no, and he has his phone number, but he also has his email here, as well as his LinkedIn profile, which is perfect. Another thing at first glance that you may be noticing about the difference between the before and the after resume is that the after resume uses a little bit of color. So I said earlier, don't use a lot of color. This is not considered a lot of color. This is actually really visually pleasing, and this light shade of blue does a really good job at separating the different bullets and the different sections of his resume, making it a lot easier on the eyes and easier to read. So my eyes immediately go to profile, experience, service, education. I like the way that he formatted the sections. Over here, he's got some positions. They're kind of out of order. It's a little bit different over here. In the after, he separates what's job experience versus what's service. So that's another word for like community involvement or volunteerism. So I like that he has the service section there as well. And then here he decided to put the education on the bottom as opposed to the top. There's really no preference. You can put the education section wherever you want to. So there's a few other things that are different about the resume, and if you take time to really go line by line, you'll be able to pull that out. But all in all, I hope this gives you a better example of what a really good, simple, visually appealing resume looks like and all of the components that should be listed in your resume. So I want to make sure that you download this free resource that's been made available to you. It's located below this video inside of the lesson in the course player. Go ahead and use this resume and cover letter checklist to revise your cover letter and your resume. This checklist comes from one of the weeks from the CHW Mentorship and Professional Development Network, which is a 6-week program that helps public health professionals and community health workers with professional development skills that they can use to apply in their work and professional setting, especially if you're interested in securing another position. So go ahead and download the free resource and use the checklist to revise your resume and revise your cover letter. It's got all of the do's and don'ts that we talked about for this presentation today. And then if you're interested in learning more about the CMPD, which stands for the CHW Mentorship Professional Development Program, I think I got that switched around. It's supposed to be CMPD. The CHW Mentorship and Professional Development Program is, again, that 6-week professional development journey during which you will unlock your leadership potential alongside a global community of like-minded public health professionals. It is a program that's for community health workers, health navigators, promotores, and others that are seeking a mentoring experience. So tomorrow, if you have not watched that video yet, depending on when you're catching this recording, Alisa Howard is going to talk about mentoring 101 and actually being a mentor. But the CMPD is about being a mentee and being mentored by individuals that have been in the public health profession for some while. So we do have on-demand course that's available for individuals, and organizations and associations can register their staff or members at group rates. If you're interested in learning more about that, please don't hesitate to contact us. You can see our contact information here on the screen. You can check us out on our website at www.chwmentornetwork.com, or you can send any questions or comments that you have to chwmentornetwork@gmail. Again, thank you for listening to this presentation. I hope you found it valuable, and I hope you enjoyed the rest of the summit. Thank you. Bye-bye.
Do something today that your future self will thank you for. Our actions and decisions today will shape the way we will be living in the future. I thank you for listening to my presentation. If you have any more questions or comments, you can email us at chwmentornetwork@gmail.com, or some of your questions may be answered on the CHWMentorNetwork.com website. Thank you again and enjoy your day.